So Manpreet is a UBC Nursing MSN alumni, and she's going to share her patient-centered research approaches with older men that informed her master's research. So I'll turn it over to Man. She's ready. Manpreet.
Hi everyone. So today I'm basically going to walk you through the last 6 years or so of my life. So in 2012, I graduated from nursing school. And I've been working at Peace Arch Hospital in acute medicine ward ever since. As many of you may know, White Rock has a very largely older adult demographic. So working with these older adults who are sick and very frail made me realize that I want to work closely with them to facilitate them spending as much time with me as possible. So in being a lifelong student like to myself, I began the MSN program in 2014. Shortly after I began this program, I met Allison Thandi. So I didn't know at the time Allison would become my teaching supervisor and my mentor, but I knew that she was an expert in the field of gerontology.
So I approached her with a research assistant opportunity. She, of course, recruited me to a study that she was beginning with researchers from the Center for Hip Health and Mobility. This project was looking at older men's experiences with physical activity. Going into the MSN program, I never thought I'd be working specifically with older men, but this study was largely about their physical well-being and their independence, so it was something I was interested in. So the purpose of our study was to enhance understanding of older men's experiences with physical activity in the context of their everyday lives. And this was in order to help develop health promotion interventions that were specific to older men. So we did this using walk-along interviews, sit-down interviews, PhotoVoice, as well as field notes. So we conducted sit-down interviews with 15 men, and from these 15, 4 of the men participated in in-depth data collection methods. And I know that you may think that 4 patients are not that many, been on a big sample size, but we actually got considerable diversity in their social situations, their health situations, and their ability to form activities of daily living. So our first theme was the things I've always done, and these were pictures taken by our participants. So participants tended to talk about a time when they were younger and how their past experiences with physical activity influenced their current physical activities. So examples were dog walking, going to tennis club every week for 40 years, and driving into their 80s. Another example is an older man who climbed up a 16-foot ladder to trim the branches on this tree that was located in his backyard. And he thought that doing this was a positive facilitator for his mental health, and he continued to do it as long as he was able. He was 80 years old at the time of our interviews. So our second theme was out and about. So this was largely about the physical environment and the outdoor environment, which had a direct effect on physical activity. So these pictures taken by the participants were large facilitators for them to get out in the community, whether they were walking, cycling, or just going out to run errands. Our third theme was you do need the group atmosphere at times, and that was a quote from one of our participants. And this was largely about the participants talking about having a social connection with the community, so whether this was tennis clubs or senior centers or walking and hiking clubs. And one man took this picture of a Louis Breyer care home because he took on a caregiving role after his wife had passed away and visited that patient every week. One of our participants was a strong advocate for senior centers. So he said, well, you do need the group atmosphere at times, that's for sure. You definitely need to join a senior center. And once you get to a certain age, I think it's very accommodating and it keeps you going. So that participant had a stroke about a year prior to her interview, and going to that senior center was a large facilitator in his recovery. Interestingly, 3 of the men associated women with being more social as men as they aged. This was interesting because the men actually had maintained strong social connections, but even built new ones as they aged. So for them to say that, it kind of demonstrated a need for them to align with societal expectations, but also a need for us to question them. So we gained some valuable insight around recommendations for physical activity programs for older men. First, focusing on programs that meet their unique needs. So overall, it appeared that social interaction, regaining strength, and maintaining balance were large facilitators for these men. So building those into programs would be key. Second, considering the influence of physical and social environments. So the men identified factors such as weather, quality and safety of sidewalks, the density of the neighborhoods, social interaction, aesthetics, and accessibility as important. So including outdoor components to physical activity programs, as well as individual and social components as well. And finally, using a participatory approach, focusing on what the older men are capable of doing. So successful programs have showed that activities that are focused around enjoyment, a sense of meaning and purpose and routine for the older men have proven to be successful. So this work formed my MSN thesis. And then we brought on John Olaf, who has extensive experience in men's health, as well as Sabrina Wong, who is the director for CHESPR at Population and Public Health. So I should mention here that in 2015, I had switched into the dual Masters of Nursing and Masters of Public Health program, and that really made Sabrina and John a perfect fit. So the current, after completing this work in my program, I continued doing some work with Sabrina Wong on a project around frailty. So this research focuses on identifying frail older adults in the community, and it's being run in parallel with these 4 universities. So we also partnered with Fraser Health in a new program called CARES. So with CARES, they do comprehensive geriatric assessments on older adults who are at risk of frailty in the community.